Hi, my name is Clive Gallagher. I am a plastic and reconstructive surgeon who specializes in gender affirmation surgery. In this video, we're going to talk about why some trans feminine patients will opt for orchiectomy, which is removal of the testicles, at a separate stage, first of all, even if they plan to undergo full bottom surgery in the future. Now, of course, for some patients, this is all they ever will need or want to do as part of their transition. And of course, for other patients, they will not need surgery at all as part of their transition. The reason some folks will do orchiectomy at an earlier stage is they may just need it for their affirmation. So they may not be at a point that they can afford, or for lifestyle reasons they can't undergo full vaginoplasty and the recovery that goes with that. So some patients will opt to do it just to help them further on their journey. There are also some medical reasons patients may opt to do it, first of all. So typically when transitioning, we do the hormones, estrogen plus or minus progesterone, depending on the patient's needs, but also what we call a testosterone blocker. Now, some patients don't do very well with the testosterone blockers and they can have side effects. The most common we see is spironolactone, which is used to decrease and block the testosterone, but it is also a diuretic, and some patients will have what we call orthostatic hypotension, or they'll get lightheaded. That's a very common side effect of spironolactone. So doing the orchiectomy allows the patient to stop the testosterone blockers, so they're able to come off these medications. Also, in some patients who are having difficulty getting their female hormones or their estrogen levels at the correct levels, removing the testicles can help with this as well. I've never found it to be a problem if we remove the testicles first for doing vaginoplasty later on. There's a myth out there that the skin can shrink and go away, and I've never found that to be the case. Typically, if we're doing an orchiectomy, it's a fairly quick and easy procedure. It's an outpatient procedure. It usually takes about an hour or less, and we typically do it through a small incision in the scrotum, and the patient can go home afterwards. Usually the downtime is about a week, give or take. Some other instructions, like we don't talk for a couple of weeks after surgery, that sort of thing. But compared to full bottom surgery, it's a much easier and more straightforward procedure in general.